Hey y'all, my name's Carissa Kay. I'm a local marriage and sex therapist here in Chattanooga, Tennessee with I Love Us Relationship and Intimacy Counseling. Today we're going to talk about the pelvic floor. We're here at Benchmark Physical Therapy on Gun Barrel Road. We're going to meet with Dr. Aaron Schinkel and Dr. Jenna Bice, and they're going to tell us about all things related to pelvic floor and why it's important to sexual health and sexual function. Let's go. How are you?
How are you doing?
Good. Dr. Aaron Schinkel and Dr. Jenna Bice.
Hey, good to see you again.
Good to see you. Thanks for having us today. So, ladies, I would love it if you could give us kind of a general rundown of what a new patient with y'all could anticipate experiencing when they first arrive and move into treatment with you.
Yeah, people are always nervous about that, right?
Yes, very much. We get tons of questions on what to expect. So the first thing, you'll walk in to the clinic, you'll sign in, and then you'll be greeted by Miss Sarah over here or Miss Savannah, and they will walk you through all of your paperwork, your payment plans, things like that, just so you're not blindsided by anything. And we want to make sure we're getting all the information that we need, such as like your past medical history, and other things that you would give to your normal doctor.
Great.
And then that information would be passed to your physical therapist that will be seeing you, and they would take you on back.
Yeah, so they'll walk up and get you, they'll get your information that you filled out, and then as you can see, really this looks like an outpatient gym in general, and we do have some of those patients out here as well, and then we would bring you back to a private treatment room. We actually have 4, so you'd be in one of those 4 rooms over here on the left. So let's go take a look.
Yeah, that'd be great. Okay, so ladies, let's start real basic. What is the pelvic floor? I think when people say pelvic floor, their minds go blank.
It's a great question.
Kind of explain what that is?
It's a fair question.
Yeah.
So the pelvic floor literally is the muscle layers that actually are on the floor of our pelvis. So our pelvis is these hip bones that we have here.
Nice hip bones.
I know, right?
That's all dance there, Aaron.
So anyway, but there are 3 layers.
Okay.
And the first layer really controls sexual function, urinary control, as well as just sphincter control.
Awesome.
Second layer is just sphincter control.
Okay.
And sphincter meaning like it just the openings, closure of the openings. And then the deepest layer is the ones that most people think of when they think about the floor. It's like the hammock that holds and supports all of our organs and like helps with our pelvic stability and our back.
Keep your organs up.
Right on.
A lot of important
So
things.
kind of important. Yeah.
It's just slightly important.
Awesome.
I tell my patients, this is the center of your entire body. Why is this not looked at, and why is it not important?
Wow.
And
they're muscles, so
Right.
we need to treat them like muscles.
Yeah.
If your bicep wasn't working,
Right.
you would care.
So they atrophy,
right?
they get weak, they get
Yeah.
overuse,
yeah, okay.
as well. Or
Fatigue.
Things get weak and
Yeah.
tight. Same
Okay.
thing can happen to these muscles.
Absolutely.
Beautiful. Thank you.
Yeah.
Okay, so ladies, I know, like in my field of sex therapy, some people claim to be sex therapists but haven't undergone specific training for sex therapy. Tell me about pelvic floor specialists. What kind of training do you have to go through to be a legitimate pelvic floor specialist?
That's a great question, because actually, unfortunately, there are some therapists who have no training that actually claim to do pelvic floor therapy, but there is specific training that we undergo, and that all of our therapists who do pelvic floor therapy at Benchmark are trained in.
Excellent.
So yes, and then we have gone a little bit further with that.
Yeah, so basically any physical therapist has gone through to get their physical therapy degree.
Okay.
Same as for us as pelvic floor specialists. So for instance, Aaron and I both got our doctorates in physical therapy about 8 years ago. And then both of us got kind of just started going right away with our education, and we started treating women's health right away.
Yeah.
So what that means is we would go on weeks and weekends all over the United States to get specialized training
Yeah.
by the best education,
Absolutely.
yes, in the United States. So we've been doing that now, different courses, for about 8 years. So much so that we last year both sat for the big
The PRPC, which is the pelvic
Yes.
rehab practitioner certification.
Good for
Yes.
you.
Yeah.
So we both received that last year.
That's awesome.
And we both wanted to do that just to help kind of set us apart
Absolutely.
with our experience.
Well, I know former patients that you've had, or even current patients that I've met, have only raved about how both of you
Thank
practice,
you.
that they
That's
feel
awesome.
safe and that you're both very competent. So that's obviously paying off.
Glad to hear that.
Yeah.
That's actually very refreshing.
Yes, and that's
sure.
why we do all of this. Like
Yes.
both of us got into this because we want people to feel safe and know that they can go somewhere to get help.
Absolutely. My next question would be, so I obviously I'm not allowed to touch my clients physically. I think that's important for people to know, to feel safe.
Yeah.
And for you, you obviously have a more hands-on approach. So if I'm a patient, if I'm a male patient, what type of work would you do, or what type of issues would I be struggling with that would be appropriate to come visit you?
Yeah, so there's various things. So it could be anything from like erectile dysfunction, where their muscles just aren't strong enough to keep the blood flow where it's supposed to be.
Yeah.
And then there's also things like, you know, penile pain, testicular pain, or just pain in that general pelvic girdle itself. Prostatitis is also a very common diagnosis where it's a chronic issue where they're always having some kind of pain down below.
Okay.
And so for men, like a lot of times patients are always very like, oh, you're gonna touch my area.
Sure.
Right? And
Yeah.
that's a very big concern for a lot of patients. And we really actually don't have to touch the private parts to make progress with things. There's a lot of other techniques or areas we can treat that actually affect the pelvic floor.
So Jenna, tell me a little bit, so some of the cases I might see as a therapist in my office would be vaginismus or vulvar pain, dyspareunia, vulvodynia.
Yeah.
Tell me
Lots
a
of
little bit about
common. So basically, for all of you guys, all of those diagnoses are basically just saying pain with sex often, or pelvic pain. And like Erin was saying, issues with men, I work primarily with women, and so I've been treating these issues now for 8 years, and so whenever those women come in, we always try to figure out what's causing their pain, what's the driving factor, and that's what really guides our treatment. It may be a pelvic alignment issue, it may be actually a weakness issue, tightness in the muscles, it could be something they've had their whole life, or something created this problem. It could be hormonal. Yeah, so there is so much. Our job is to help women learn about their bodies, and then for us to fix what's causing their pain.
So biofeedback training is a wonderful tool that we use as physical therapists. And it essentially will show you how your muscles are working, whether they're drawn up or too tight, or if they're just weak and they can't move very much. So it's a very non-invasive, and they keep their clothes on. We have a couple different tools. I'll kind of sit back here. But so the first thing is going to be, so this is a biofeedback setup. So this is the machine. We would hook external wires. So this actually does not go, this goes on the outside of the body, the outside of the body, and it goes around the pelvic muscles.
Okay.
And this is kind of our grounding wire. So these are stuck on the outside. It connects into this wire here, and then this wire connects into this machine. And if you are able to see on the machine, it actually has a little red line that when you're using your muscles, it will squeeze and go up. And then when you're relaxing your muscles, it comes back down to a normal resting tone. So you kind of figure out, are they holding tension?
That's awesome.
Or are they able to squeeze their muscles appropriately?
Yeah, so if someone's just resting and they turn this on and we're up at the 10, that to us is like, oh, you're holding a lot of tension in your muscles all the time. Or we even have patients, it's not really that uncommon for you to be like, okay, I want you to try to do a Kegel, and they relax, and you say relax, and they contract. Like their muscles are so out of sync that they're doing the opposite of what they're trying to do.
We call that dyssynergy.
Yes. So all of that being said, I mean, there's a whole lot of information that we can help by
Just a lot of educating.
Absolutely.
That's awesome. Thank you. Thank you so much for tuning in today. We hope the information has been helpful and beneficial to you in some way. It was a pleasure to talk to Dr. Aaron and Dr. Jenna today at Benchmark Physical Therapy. And as a local therapist, I want to encourage you that as many people as there are that struggle or wrestle with pelvic pain or pain during sexual intercourse, there are professionals in the area that know how to work with issues around these. So if you have any interest in becoming a patient, or if you have any just questions or concerns in general, please don't hesitate to reach out. We would love to be a resource for you. And if you enjoyed this material and want to see more of this in the near future, please don't hesitate to leave a comment and share with your friends and family. Thanks so much.